Okay, so let's have a brief look on the discussion of IV cannulas which are commonly used in the clinical practice. So what you see here are the five commonly used IV cannulas. The first one which you see here is the yellow IV cannula, which is 24 gauge, the blue one which is 22 gauge, pink one, okay, which is 20 gauge, the green one with 18 gauge, and the gray one which is 16 gauge. We also have an orange IV cannula which is 14 gauge. Okay, so these are arranged in the increasing order about the length of the needle and the bore of the needle. Also, the amount of the fluid which can be transfused differs. That is, it is in the ascending order. So let's see one cannula and see their parts. Okay, so this is the most commonly used IV cannula, which is the pink cannula. Okay, so what you see here, what I'm holding here, the knob which is there is usually connected to the three-wave cannula, three-wave, after the securing the peripheral IV access. What you see here, this part which is a small chamber, and where the needle ends is the flash chamber. So when you are into the vein, there is a small droplet of blood here which indicates that you are in to the vein, and now you can proceed. Okay, this is another intermediate part, and this part is usually to maintain a firm surface onto the skin, and above this part we apply the dynaplast to stabilize the IV axis. Okay, so this part is the cap of the needle, and when you can see it, one second. So this is the needle. Okay, yeah, this is the needle. Okay, so the point is the sizes which are there, they also differ in the length of the needle, okay, and the bore of the needle as well. So, and the other point is, so as you can see is that the pink needle which is there, pink IV cannula which is there, it can infuse the some amount of fluid which is 56 ml per minute. Okay, whereas what you see here in a gray cannula is 200 ml per minute. So you can guess that why there are these different needles, and they can be used in different conditions. Okay, so let's see the practical implications. Okay, so the yellow needle, which is the smallest needle, is used in pediatric patients. Okay, the pink needle which is there, that is the bare minimum needle which we need if we are sending a patient for CT scan. Okay, and if there is a contrast enhanced CT to be done, or a contrast any scan to be done, we need the bare minimum of a pink needle, so that we can connect it to the contrast and may have a contrast enhanced CT scan. Okay, the green needle which are there, which is the 18 gauge, this is the commonly used so in patient with shock. Okay, so when there is a patient in shock, we secure two wide bore IV lines which are the green, which is 18 gauge. Okay, if you want to memorize the color of the IV needle, pause the video and look at this. This is a mnemonic by Marrow to remember the color coding of the IV cannulas. So other few clinical implementation points are, so for example, if in emergency you have a patient of CKD who has a fistula in his left hand. Okay, so fistula, and AV fistula is made in the left hand. So which hand you will prefer to make a peripheral IV access? The hand is a non-fistula hand, because if you give a peripheral venous access in that hand, you might destroy or damage the fistula which is being matured or produced after 2 to 3 months for specifically the use of hemodialysis. So you do not disturb that fistula, you make an IV access into the other hand where there is no fistula. Okay, the other point is in patients who are to be admitted into the intensive cardiac care unit, ICCU, so there the cardiologists prefer to have an IV access in left hand preferably, because they might do surgeries or they might do interventional procedures like angioplasties or cardiac interventions using the right hand, so they want preferably an IV access in the left hand. Okay, the other point is, if you have a center line in position and you also have a peripheral line access, you do not prefer to give any fluids from the peripheral line. You have to solely use the center line access. Okay, and the other point is, if you use peripheral line, when the patient is having a central line access, you might have edema of the same hand. Okay,